Hey,
Hey there.
how you doing, Doc? How are you?
I'm good, thanks. How you guys doing?
Good, good. We are actually on the road. I know you were asking us earlier. We just left Indianapolis, and now we're heading to Chicago, which should be about a 3 or 4 hour ride. But with the charging stops, we have to stop almost every about 2 hours to charge the car. So we have 2 charging stops in the middle.
Okay. So how many miles are you covering a day?
It depends on where we're going. At least about 500 miles a day. Today
Okay.
we're going to cover a lot because we have to go from Chicago and then we go to Minneapolis. So at least under 1,000 miles. I mean, it's quite a drive. But we have a crew of 12 with us, and we keep ourselves busy by doing things like this: Twitter, Facebook, Periscope,
Yeah.
and just keeping ourselves busy. I mean, we've had such a tremendous response. Every city that we've been to, we've gotten families and couples and guys to come out for the initiative and get inspired on the social media events, and we've been getting good media attention. Usually, your stuff gets very good media attention, but when it comes to men's health, it doesn't.
Right. Well, that's why you need to do it, though, right? I think we need to bring some attention to the issues.
Yeah. So this is I don't think I'm Jamin, Dr. B, and this is Dr. P.
Hey
Dr.
there.
Soto.
Yeah. So you guys are taking turns driving?
Well, usually he drives because I handle all this stuff because he's a much better driver than me, and I'm much better at social media than he is. So.
Okay.
Hey,
thank you so much.
So Doc, just hold on 1 second. We have a crew of 12 coming with us, and they keep calling us.
Okay.
So
hello, John.
I just want to make sure there's no car crash or something that happens somewhere.
I got you.
Okay, got it. Okay. So Dr. Soto, tell us exactly who you are, what you do for a specialty.
Right. So I'm a plastic surgeon by training, and I do aesthetic surgery. We do cosmetic surgery of the face and body. So, like most guys who have my expertise, the majority of our patients are women. So we are starting to see a growing trend, growing interest among men. I think it's a healthy interest as long as, they get good advice from good guys. Hey, man, how are you?
How are you?
So dudes get plastic surgery?
Yeah, absolutely. It's not the same stuff. It's not parallel with what the women are interested in or what we would recommend for our female patients. But yeah, absolutely. There's a growing interest among men.
Oh, wow. That's cool.
Yeah, I think it's, at least in my practice, I think it's been a healthy kind of an interest. I think, the average guy, we're retiring later. We're, staying more active. Wanting to remain competitive and look good, in our lives. And I think as long as, the things that we're approaching are safe and effective, it's all good.
That's awesome. So tell us, I know there's a lot of misconceptions about plastic surgery, and the reason I requested to have you on is because whenever you're on the media talking about it, it's like real. I never see you selling a product or anything, and you're very honest about what you're talking about. And it's there's other physicians that do what you do that I've seen in the media that it just seems like they're just selling something, but you're always honest about what the risks are, benefits are, and when you can do this. So I appreciate that. So I was wondering, overall, there's a lot of misconceptions about plastic surgery. What would you say some of those things are? And it's not just what you see on TV. So.
Yeah, no. There's a lot of stuff. We joke around here that when I retire, I should write a book about some of the things that we see and we hear and that people think. I think that plastic surgery and aesthetic treatments can be very healthy, under the right circumstances. But it's important to approach them in the right way. I think one of the things we were talking about earlier this morning, one of the more common myths that you'll see out there is that if you have liposuction, for example, on one part of your body, that other parts of your body will become heavier, that you'll pick up fat in other parts of your body as a direct result. You'll see it on the internet all the time. You'll see women will post things like, I had liposuction on my stomach and now my arms and my butt are bigger. It's like, don't have liposuction. And The funny thing about that is that just like any other myth, there's a little bit of truth to it that makes it propagate. And the thing is, what most often happens is that if you eliminate some fat from patients, say in the abdomen or the torso, there are fewer fat cells on the torso. Wow, that's a cool view. There are fewer fat cells in the torso area that can then pick up fatty tissue. So the patient sometimes some patients will go home and they'll start to eat because their pants are loose.
Yeah.
And of course, because they're taking in more calories, they start.
Hey, I was trying to join him. Yeah, needs to get out, or let me just mute her. Okay, all right, there you go. She can join the call just in a different room. So sorry, go ahead, sir.
Yeah. So I was just saying, sometimes if patients don't realize that they're consuming more calories as a result of a diminished waistline, they'll pick up some weight in other places where they still have fat cells. So their butt and their arms do get bigger, but it's not really a direct result of the liposuction. It's a direct result of their increased caloric intake.
Wow, that's really interesting, huh? So what are some things that guys get done?
Well, after about age 25 or 30, the metabolism starts to slow a little bit, right?
Yeah.
So, guys will complain about love handles and stuff like that. So one of the most popular things that we do for guys is cool sculpting.
Yeah, what is that?
Cool sculpting is basically it's a treatment that's based on the science of cryolipolysis. So we apply a treatment device to the area of excess subcutaneous fat, and over about an hour, 20 to 25% of the subcutaneous adipocytes are killed by the.
In 1 hour, I could lose my
Yeah.
Really?
Yeah, it works. It's.
So can I see a difference in my weight too?
I wouldn't expect to see a difference in your weight. Subcutaneous fatty tissue is really very low density. So even with pretty significant changes in contour, we don't often see a big change in the number on the scale.
So I can wear like a tight shirt and buy skinny clothes afterwards, or?
That's the idea, is to get rid of the love handles and little areas like that. And guys actually respond to it pretty nicely because our skin is nice and thick. So the outcomes are very good.
Because my wife always said my head is nice and thick, like.
Yeah, I think your wife's been talking to mine.
So that's pretty neat, man. So what are some of the other things? Because I just want to say this out there. There's a lot of, and I think guys guys are interested in this, but they just don't want to admit to it. Like, when we started media, I was told that I may need to wear makeup, and for the first couple months, I'm like,
right.
When you got comfortable with it.
Yeah.
Not that I wear makeup right now, but
just ask him what's in his right pocket.
It gets easier. You get more comfortable with it. I've got a nice foundation on right now.
Yeah. So the thing is, like, guys need, this is important, and even though we want to be healthy internally, we want to be healthy mentally, but physical appearance matters.
Absolutely.
You're gonna feel good, and you're gonna want to take the steps to continue to look good.
Absolutely.
So what do you think some of the barriers are in your practice or just in your field in general that doesn't get more men out there to do what they can get done in your office?
Well, I think there, psychologically, there's a conflict between, wanting to intervene in your health or your physical appearance and the concept of being manly, right? So, on some level, for better or worse, and whether it was deliberate or not, in the United States, we have this concept of manliness. And part of being manly is, accepting whatever life gives you, and just being really stoic about it, right? And so that there's a little conflict between that image of the American man and going to a doctor and saying, hey, I want my skin to look better, right? So I think we have to overcome it. Yeah, right. So, we need to overcome that a little bit and realize that, you can still be a man and admit that, you'd like a little help, whether it's help with, keeping your heart healthy or help with, you know, avoiding sun damage and getting rid of some unwanted fat.
Wow, that's really good. So, in terms of if someone was to get, you know, you are in a surgical specialty, as are we. You know, what are some things that guys can do to get better outcomes? Now, one thing that I always say is stop smoking. Even if you stop smoking the day come and get my surgery, you're going to get a better outcome. What are some of the other things that you tell your patients to in preparation for some of these procedures?
Yeah, you know, I think that one of the biggest obstacles that I have to overcome with my patients, and it is a bigger obstacle with my male patients than it is usually with my female patients, is honestly compliance. You know, I think, you know, again, most guys, they think that, you know, having a treatment done is a, you know, a drive-through experience. You know, I'm going to have this done, and, you know, as long as I don't have any problems, I'm not going to ever see Dr. Soto again. You know, I'll call him on the phone, you know, a month from now and let him know I'm doing fine. So I have to talk with my guy patients and tell them, look, it's important for you to, you know, come to your appointments and follow instructions and do the things we tell you to do, because that's when you're going to be safe and get the best outcome. Yeah. But yeah, I think that, you know, if the patients smoke, yeah, that's the first thing we go after too. You know, you got to stop smoking because, you know, nicotine does terrible things to healing capacity. So we really want that to stop. And I think a lot of guys, you know, certainly a lot of my professional patients, I don't think they drink enough water. And that really affects skin health and how people heal too.
So I know just we have some question that actually one of our crew members messaged me. And
all right.
I know they're trying to be funny, but in a serious manner, I know we can answer this. Is what about, you know, because he's basically saying I've lost weight, but now I have man boobs. So like you mentioned the cryo thing, is there any way or anything that can be done, you know, for something like that?
Absolutely. So, you know, when we talk about man boobs, we have to realize that there's different reasons that different men will have the appearance of excessive or overgrowth of the breast tissue. So there's true gynecomastia, you know, where a man will actually develop some excessive breast glandular tissue. And that, you know, can sometimes be just hereditary, or it can happen because they're consuming something in their diet or something recreationally that is producing that tissue overgrowth. In some patients, it's just from excess accumulation of fat. So when some guys get overweight, what most people don't realize is that fatty tissue increases your estrogen load. And that can cause some guys to develop some breast tissue and produce.
And they can lower their testosterone.
That's exactly right. That's exactly right. So that'll increase the growth of the breast tissue too. Now in people like what sounds like your crew member is experiencing, people who have gained weight and then lost it, most often if they look like they have man boobs, it's just loose skin that's hanging. And in those circumstances, there's different options that we would use. So if there's excessive fatty tissue or excessive glandular tissue, then cool sculpting is a great option, as long as they don't have, you know, a firm discoid mass, in which case surgery is the best choice. But if they just have like lots of loose skin because they lost a lot of weight, depending on how much skin they have and the appearance of the chest in terms of, you know, where the nipple is sitting and things like that, we could sometimes do a combination of cool sculpting. We might do a skin excision and remodeling kind of a procedure. In some patients, all we need to do is put some nice pec implants in there to fill up the skin. Yeah. And that gives them a nice, firm, masculine appearance.
Sidra, you're interested? This is pretty cool. You know, they just asked, and it's good that you.
Yeah.
The two of us, man.
Yeah, we should go to his office. We should make it a men's health event. Yeah.
Yeah, let me know when you're back in town. We'll talk about it. They come in all sizes.
So where are you located again? I think you're in Orlando proper, or?
Yeah, I'm in Orlando on Dr. Phillips Boulevard, in the Dr. Phillips neighborhood.
Oh, so you're in my hood.
Yeah, is that where you guys are?
No, we're in Claremont at South Lake, which is in affiliation with Orlando Health, but I live on Apopka Vineland.
Yeah, you live
cool.
I live in Windermere. So.
Okay, cool. So you guys are both close to us. We're across the street from the YMCA.
Oh, nice, nice. So go work out and get your cool sculpting at the same time.
Yeah,
Right?
that's the idea. Yep.
So top three things that you want to tell guys all out there. It doesn't have to be specific to your specialty. Men's health in general. We're talking a lot about statistics. So we actually did a survey to Orlando Health. We surveyed 1,000 men and found that over 80% knew the make and model of their first car, but only half knew anything about their last doctor's appointment.
Right.
All against men. Mental health disorders, physical disorders, cardiac disease, prostate issues.
Right.
If you could give us three things to motivate guys, what would they be?
I think number one would be take better care of yourself. Just kind of, just blanket, take care of yourself. Even though you and I have a really good understanding of this stuff, I bet that you would agree with me that you don't think about your own health enough, right? I mean, I'm always worrying about, my practice or worrying about my family, my kids, my house, stuff like that. And I don't really spend very much time thinking about my own health. So, I think that's number one. More specifically, I would say, think about your skin. The skin is a big organ. It's the biggest organ in the body, and we take it for granted. And we can't do that, especially living in Florida. We get a lot of sun damage, and it's important to take better care of your skin. I think wearing a little bit of sunscreen every day goes a long way towards staying healthy in the long run.
One thing, actually, this is a question I've always had is skin and creams and stuff, like, if you're prone to acne,
Yeah.
is that if I put cream or lotion or sunblock, is it going to make me more prone to acne?
If you use the wrong
I
one.
don't always use cream is because I'm worried, even though it's non-comedogenic, I just feel like the oil makes it more me acne prone, and then I get all this stuff. Now, is that true, or is it a better cream that we can use?
Yeah, there are better quality products that you would want to look into if you're prone to eruptions and skin problems. You definitely wouldn't want to be doing the drugstore thing, because a lot of the quality of the ingredients is important.
Okay, thank you. And number three.
I would say number three is, realize that it shouldn't, you're not saying you're less of a man to ask for help. Whether you're asking help from, your neighborhood urologist or from your neighborhood plastic surgeon, it's okay to ask for help. You're still going to be a guy. You're still going to be a good dad. Everything's good.
Yeah, there's definitely a lot of healthcare professionals out there, and, ask for help if it's your friend or your wife or your partner. Ask them as well. It's just starting that first conversation. So, Dr. Soto, thank you so much for taking the time to chat with us today.
Thanks for having me. It was fun.
Yeah, and next time maybe we'll have you join us on a segment. We're always looking for drivers to join us on this
cool.
of 6,000 miles. So thank you so much, and thank you to your team at your marketing team for helping us set this stuff up. I love them. I love Brian and his wife. They're awesome people. So thank you.
You do a great job. Thanks for having me. You guys drive safely, okay?
Thank you so much.
Thanks, buddy. Thank you.
All right. Bye-bye.